Welcome to another session of Voices in Health. I'm your host, Dr. Barbara Kostick. Today, we're going to feature the Legacy Strength Training Program at Washington Hospital's Outpatient Rehabilitation Center. The center provides orthopedic physical therapy and outpatient occupational therapy. These are services performed by highly educated therapists, and the goal is to help the patient return to the best functional and pain-free level possible. I'm with Dr. Desmond Erasmus. He is the medical director of the Taylor McAdam Bell Neuroscience Institute's Minimally Invasive Spine Program. Welcome, Dr. Erasmus. Dr. Erasmus, as a neurosurgeon, how do you use physical therapy?
I use it on all my patients that present to me with back pain, and back pain is present in everybody.
It's pretty common. I've had back pain.
I think I have too.
Like you over-exercise or ride in the car too long. But what kind of patients do you see that need physical therapy?
Most of my patients require physical therapy because they're coming to me with pain, and 9 out of 10 don't need surgery.
Oh, and you're a surgeon.
And I'm a surgeon. So 10% of my patients come to surgery. But the ones that don't need to get well and get back to a functional life.
Do physical therapists act just as cheerleaders, or do they do other things too?
They have two types of treatment that they initiate. When the patient presents initially with a lot of pain and spasm, and they can hardly move, they can have trouble getting out of bed, they go to the therapist, and the therapist applies passive modalities of treatment. That means that's hands-on. They tend to apply hot packs and ultrasound treatments and electrical stimulation to try and get the spasm eased up.
To get the muscles to relax around the spine.
Exactly. When the patient is feeling somewhat better, then they move on to a more active exercise routine, which the patient is then expected to do for the rest of their life.
So physical therapy lasts forever.
It lasts forever.
Well, what about if I want to maintain my strength? Do you have any programs for that too?
For maintaining your strength, we have, at Washington Hospital, we have the Legacy Strength Training Program that is invaluable.
And who do you refer to that?
That is particularly useful for our older patient population who are developing osteoporosis and osteopenia. The program was developed in Florida, where there are a lot of people from the East Coast that go and retire in Florida, and there were a lot of compression fractures and broken bones from falls. So they found that the strength training program was particularly useful in keeping the bones strong. And as the muscles got stronger, falls were prevented too. So hip fractures were less, and so on.
So it keeps older people young by keeping their strength and balance.
Yes, it does.
They do recommend that for osteoporosis prevention that you do weight training twice a week. So would that be a way to continue staying well, is doing it maybe twice a week?
That would be ideal. Absolutely ideal. When you fall and develop a compression fracture, it is so debilitating, and a part of your life is on hold for at least 3 to 6 months before the pain eases. And sometimes once you develop that compression fracture, the pain just kind of remains around, and then you have to get into pain management. So to prevent that from ever happening, it would be really important to stay exercising.
That's right. And Dr. Erasmus, this whole time you have not talked about drugs controlling pain. You've said that exercise can just help prevent the pain so you won't need the drugs. That's a great comment.
Yes, it is.
And you've also pointed out about falling in older people, and I know the studies on osteoporosis and hip fractures in women especially, because we're more prone to it, something like 20% of women after a hip fracture don't get out of the nursing home. So just think, if we can prevent that fracture in the first place, how much healthier we'll be.
If you exercise, you release chemicals in your brain, which are called endorphins, and it blocks pain, so you take less pain pills. If you take less pain pills, you have the benefit of being less constipated. You get regular. So if you want to stay regular with your exercises.
Thank you. When we come back, we'll focus on the Legacy Strength Training Program and a special workout that produces better results than traditional strength training. Thank you. So good to see you.
Check it out, man.
What is that?
It looks like someone's belly. Eh, probably lost it walking on the beach.
Man, just leave it. Let's go.
Sure, they're juicy and delicious. But did you know fruits like melon and mango are packed with vitamin A to help you see better? Eating fruit can also help make your teeth, skin, and hair healthy and strong. Can your food do that? Run, throw, think, eat better. Find out more at smallstep.gov.
The Legacy Strength Training Program is a natural choice for building strength after completing physical therapy. And physicians often recommend the program as a way for patients to build up strength prior to surgery. At first glance, what goes on here may be reminiscent of what you'd see at just about any gym. But Legacy Strength Training Program is quite different from other programs. Here, they use a scientifically based fitness approach known as slow motion exercise, which utilizes a high intensity but low force exercise regime. Joining Voices in Health is personal trainer Leon Jones, the Legacy Strength Training Program coordinator, and Sharmi Mukherjee, a physical therapist with Washington Hospital. Welcome. What makes Legacy Strength Training unique?
Well, a lot of different things. It's a very controlled setting. The cadence with which a person goes through the motions uniquely offers or imparts a strength gain that's heretofore never been seen in other parts of other types of strength training. Also, another unique feature is the one-on-one personal trainer. He or she guides the person, documents, and really facilitates a strength gain.
But what about, aren't there other forms of physical therapy?
Physical therapy is basically something we do for all our patients who ever come in with a referral. So we see pretty much back patients, knee, shoulder, that could be post-op, pre-op, and the main thing that where Legacy Strength Training adds an adjunct to the physical therapy is when we get the patient to a certain maximum potential, we basically refer them and see if the Legacy Strength Training Program might be appropriate for them to maintain that level. Definitely we give them home exercises to maintain that, but it's not always something the patient likes to do at home. They need that extra support, that extra boost that Leon and the other trainers provide. So for a lot of patients, it's actually helpful to get them from the physical therapy and move them to the Legacy Strength Training Program.
Now, Legacy Strength Training does something with slow motion. How does that help?
Okay, slow motion exercise is a program that's very controlled. The cadence goes up in a very controlled manner. We use a stopwatch to time the mechanism. And the slow motion has been proven to be quite effective in imparting strength gains to age groups that vary from a low of 13 all the way up to presently 96. And as Sharmi just got through saying, it has been a pretty seamless transition from physical therapy over to us, and we've been able to pick up the ball, and the preparation has been good.
So how does this differ from a gym?
Well, in a lot of ways. The most important of which is time. We're an extremely time-efficient program. People are in and out, work their entire body in about 20 to 30 minutes. There's no waiting for equipment. There's no waiting for a trainer. We only need to see a person twice a week. So with a personal investment of about 40 to 45 minutes a week, a person is able to maintain strength in a much more time-efficient manner compared to a gym.
There you go.
The main important thing is the one-on-one personal attention that all the clients get, and that is not something that is available at the gym. Mainly, a lot of people, in fact, are intimidated to go to the gym because they don't know how to use the machines, they don't know what to do, and sometimes it's expensive to have a personal trainer, and the personal trainer may not be able to guide you, you know, exactly to what you want either. So that's where this program is a little different, because Leon or the other trainers go through them one-on-one with all the machines. They're sitting right there in front of you, guiding you, telling you how much to push. So
that should be a big safety issue then too, because I hear in the gym you can get hurt if you aren't supervised appropriately on the equipment or with the amount of weight that you tend to use. And how's your safety record?
In fact, that's one of the biggest features of the program. It's extremely, as I said earlier, effective in increasing muscular strength. But because of the slow cadence with which we go and the fact that we're in close proximity the entire time with our clients, safety is virtually guaranteed. We go very slow. The only thing we're putting through stress really are the things that need to be muscles. The rest of the body is going through space at a relatively safe pace.
Okay, so I'm working on a machine with you watching me, making sure I go through as slow as possible to do the exercise. How do you measure my improvement?
Okay, now improvement is measured exactly. We quantify with a stopwatch. We time to the second. We even quantify the resistance or weight down to 8 ounces. So this is also not only chronicled or logged, we compare this and it provides the basis for future sessions. The time drives the weight. Depending how well the participant does, that determines where we're going to go with resistance.
What's the average amount of time that a patient does the exercises before they see improvement?
Rather rapidly, 2 to 3 months, which is relatively fast in terms of strength training, people start noticing results. And the biggest reason for that is because of the efficiency. We have people working the entire time with an ultimate goal down the road of being able to push them to their maximum. Of course, we start as slow as people need to start, and we progress as quickly as they're able to.
With this kind of strength training, you're doing weight-bearing exercises, and you know, that's one of the things they tell us we women need to do to prevent osteoporosis. You know, twice a week weight training with, they call it axial loading. Is that what you do too at Legacy?
Yes, strength training in various forms, whether it be weightlifting or our protocol, safe strength training, slow motion training. One of the benefits is osteoporotic scores are improved because it is a weight-bearing exercise form.
Sharmi, do you think this kind of program is for everyone?
Yes and no, because I think there is a certain population which might not be ready to go ahead and go for the Legacy strength training, and that's where Leon and I work together, because there might be patients who need the strengthening but they're not ready for it yet. So we will make sure we provide enough information to the patient and to the doctor, and maybe get them through physical therapy first, get them to a certain baseline so we are safe, and then move them on to the Legacy strength training program.
It's really a product not only of what we do, but it's the machinery that we use. The machines are infinitely modifiable to accommodate range. We quantify down to 8 ounces, so certainly strength restrictions. So we're able to screen in people who would be at serious risk in a usual strength program like a gym.
And I found that when people start doing strengthening exercises that their balance gets better too. Is that true?
Yeah, there is enough studies showing recently that strength training actually improves balance, and we actually, for our fall risk patients in physical therapy, have started doing a lot more strengthening, along with, of course, balance training too, but we've incorporated strengthening with balance training now, so yes, it definitely.
Well, and then you could do aerobic exercise better too, right? If you've got better balance. So do those two complement each other, Or if I did strength training, I wouldn't have to do anything else?
They certainly do complement each other, as you say. And in fact, we encourage people who are capable to go ahead and do aerobic exercise. But it all builds, just as Sharmi says, as a person feels more confident, their strength goes up. They're able to venture out, not just to do daily living things, which for a lot of people is a very worthwhile goal, to increase their ability to be independent around their own household, but they also are more likely to venture out and do other things. One lady in particular, she was a lady in her mid-70s that came to me, and after we were doing some evaluation, she said, my real goal is to be able to continue traveling. I said, I don't see any problem in that. I think we can help you with that. She says, no, I don't think you understand what I really mean. I want to be able to get on the airplane and put my own overhead just above me in the seat without any insistence.
That's a little hard.
Okay?
Yeah.
So after a few months in, she came in, as usual, beaming. So I says, you're in a particularly good mood today. What happened? She says, well, I went traveling, and not only was I able to put my overhead, a gentleman behind me was having difficulty, and I helped him put his in there.
Oh.
That to her was, had we stopped then, she'd have been happy. That was pretty incredible.
I would just like to add that the muscle strengthening program is just an adjunct to exercise. That does not mean that's all you do.
Oh, shoot.
Yeah.
It is required that you exercise 5 times a week now, and you can have other things, the rest of the week. You could do yoga, you could do walking, but it's not the only thing you should be doing.
Yeah. Just as we said earlier, Barbara, going back to the strength training itself and how time efficient the program is, it frees up people to do other things. Plenty of time, 2 20-minute sessions a week. Twice a week is all we want people to come there, all we actually will allow them to come there. So they have plenty of times to do other things, the things they like to do, their hobbies, do other stuff.
Well, is this program covered by insurance?
Presently, our program is not covered by insurance.
But neither is a gym membership,
Well,
usually.
That's true. And-
Nor cosmetic surgery.
That is very
And
true.
the personal trainer aspect in a gym is actually significantly more expensive than are our prices. And as I said, you have the benefit of being in quite a serene environment and with a personal one-on-one trainer the entire time that you're in the program.
Thank you, Leon and Sharmi. When we come back, we'll hear from 2 longtime participants of the Legacy Strength Training Program.
Mom?
Dad,
How long should I wait for you?
if I'm at soccer practice,
What if something happens? Will you come get me?
There's no reason not to have a plan in case of an emergency,
Should we go to the neighbor's house?
and some extremely good reasons why you should.
Can you tell me?
Talk to your family about what you would do in case of an emergency. For more information, visit www.ready.gov.
Can I help you, sir?
Found these over by the stairs.
Okay, thank you.
What are they?
Love handles. Lots of people lose them taking the stairs instead of the escalator.
We now welcome to Voices in Health 2 Legacy Strength Training Program participants, Jim Sissle and Keith Kato. Jim and Keith, tell us what drew you to Legacy.
I saw the opportunity to work on my physical situation and do it in a short period of time investment.
And has that happened?
Very much so, immediately.
And Keith, what about you? How did you find Legacy?
Well, I was referred there by Dr. Erasmus because I was having back pain and I had sciatic pain in my leg.
So you thought you had to have surgery?
Well, exactly. And I have had back pain for, 10 years or so. And he looked at my MRI and said that you don't need surgery, which was the best news that I could ever get. He checked me out and referred me to Legacy, and I've been there for 3.5 years with remarkable results.
When did you first start noticing improvement?
I would say in about 4 to 6 weeks. That's, the pain started to subside by that time. And then from there, it was like, just went straight up. It was incredible.
Jim, when did you first notice improvement?
I seem to feel it happened almost immediately, especially in my balance, I could tell.
That's amazing that doing strength training actually helped you with your balance. It's really important not to fall when you get older, right?
Definitely, yes.
Yeah. And what about you, Keith? How are you doing now with your strength training after 3.5 years?
Well, I'm doing great. I'm going just once a week just to kind of keep it, stabilized, but I seem to be improving in my performance. So I'm still gaining. I'm back playing tennis, I'm jogging, and it's just totally incredible.
As you're an athletic person, has your sports improved too?
Well, it's not quite what it used to be, but I'm happy where I am.
Tell me about a typical session. What do you do when you go there?
We start out on one machine with leg lifts, and 20 seconds later, 180 pounds of weight.
180 pounds of weight you push, huh?
On some of the machines, it goes up to that much.
Boy, that's amazing. Do you ever think you
Yes,
thought you'd do that a year ago?
Didn't expect that to happen, no.
I mean, the main difference is that it's overall body strength. They're working on all parts of the body. It's not just, I went in for back problems, but they're building up my legs, they're building up my shoulders. I was mad at Leon because I had to get bigger shirts because my neck size. Honestly, I had an event to go to, and I took out a white shirt, and I did one like this, and I had to go buy a new one, and that's what's happening.
And what do you think about the personal trainer, Jim? Did that help you?
Oh, definitely it does, yes. That's what it's all about, because you have somebody that's being sure that you're doing it in the right position, with the right amount of weights, the right amount of time, and that's monitored very closely, with the encouragement that's given verbally also.
Have you started doing other exercises too now? Or?
Not to any great extent so far, no. My story is, for 10 years I was a primary caregiver for my wife. She passed away about 2 years ago. So I spent a lot of time obviously seeing to her needs and not my own. So when I saw this strength training program, I said, well, it was time for me to get back in a little better condition.
Did Leon help you too?
Well, I love the one-on-one training because they set you up, they get you comfortable, and they let you, they do all of the different weights, and it's all documented. And then you go when you're ready, not when they're ready. The encouragement is, I wouldn't be able to do it if I didn't have that encouragement to push. Sometimes I don't like Leon so much, but I know he's out for my benefit.
Do you think a person ever is too old for this?
No, I don't think so. Not as long as you can maintain it and keep up with the program, and there's no reason why not to.
And how would this differ from a gym? I mean, do either of you have gym memberships to compare it to? Or?
No, I don't.
Do you think you need one?
No. I've always avoided that. And as we've said, with Leon there right with you, you have a trainer, personal trainer, constantly, and make sure that you don't do something that injures yourself or whatever. So it's much, much better. And you don't have that sweaty gym atmosphere.
Who would you recommend for this?
Anybody and everybody. And if they feel that they have a physical problem, well, they should perhaps see their doctor first and get a recommendation.
Thank you, Keith and James. And thanks to all our participants. As we've seen, slow motion exercise addresses the key elements necessary for a complete and results-driven workout. The program is unsurpassed in safely increasing physical conditioning. Washington's Legacy Strength Training Program might be just what you're looking for. Thank you for watching. We'll see you next time on Voices in Health. To find out more about how the Legacy Strength Training Program can help you, call 510-794-9672. Come by the Washington Hospital Outpatient Rehabilitation Center or visit our website at whhs.com/legacy.